Raise your hand if you are intimidated or scared to call doctors. I definitely was when I started off as a new nurse. And so these are 3 things that I recommend you do before you call a doctor about something. Number 1 is troubleshoot as much as you can before calling the provider. Obviously, there are things that you just have to call about regardless, but there's a lot of things that we can do as nurses. Maybe you already have PRNs. Maybe you can talk with your coworkers or a more experienced nurse and ask like, hey, this is what I'm thinking about calling about, but is there anything else that I should be, thinking about or I'm missing? Doing a little troubleshooting beforehand can save you from calling about something that maybe you didn't need to call about in the first place. The second thing is write down everything that you're going to notify the provider of. There is nothing worse than notifying the provider of something, hanging up and being like, I forgot to say this one thing. So write down everything that you are notifying them of so you don't miss anything and you can make the most of your time during your phone conversation. And the third thing is to anticipate what outcomes or orders you're expecting from the provider. Maybe you're calling just to notify them of something and you're not expecting any orders. That's fine. But maybe you're like, okay, I'm expecting them to order some pain medicine or maybe change the fluids or maybe more frequent labs. At the end of the day, it's not our job as a nurse to decide what to order for the patient. However, it is really good practice to get into thinking about and anticipating what the provider may order. So those are 3 things that I would do before calling the provider. Hopefully that helps make you a little less intimidated next time you have to phone them.